think we're good. All right, we're going. All right. So we are so excited to have Dana Ullman on this episode of Decolonize Your Healthcare. Really just a conversation about how people can take empowerment over their health, specifically for their families, really working to heal themselves, get connected, that sort of thing. So Dana, thank you so much for agreeing to be here. I really appreciate you so much.
My pleasure, my honor.
Yes, definitely. So tell the audience a little bit about homeopathy, about your background. I've followed you for many, many years, but I'm sure listeners would love to hear from you.
Okay. I'm here in Berkeley, California. I did my undergraduate work at UC Berkeley, and I did my graduate work in public health. So the MPH after my name is a master's in public health, though I also call it a mighty fine homeopath. And in my junior year, I began to study homeopathy seriously. And that was in late 72. And I actually began to practice right after I graduated from Berkeley in 75. And I was honored then 18 months later to be arrested for practicing medicine without a license.
Fine honor,
I, I, I was arrested on Cinco de Mayo, which is Mexican Independence Day, which I always thought is pretty good. And immediately a group of people got organized to help support my efforts to fight this arrest. And we created in 1976 and 1977 3 holistic health retreats. It's called Harbin Hot Springs, which is a beautiful hot springs about 2 hours outside of the Bay Area. And we brought around 400 people 3 times and raised $6,000, $5,000 to cover my lawyer and $1,000 to start the first holistic health peer-reviewed journal. And the trial date was set for the founder of homeopathy's birthday. So that was definitely a good sign in April 10th. And we ended up winning the case 3 weeks before the trial date because my lawyer wrote a settlement that said that I was not practicing medical care. I was providing health care. Mm-hmm. And the difference is I was not treating any disease.
Yeah.
I was treating a person. Mm-hmm. And so I ended up winning the case. And then I decided not to practice at all. Instead, I went to the School of Public Health at Berkeley, got my master's there, and then spent the next couple decades writing 10 books, publishing 40 books of my colleagues with a publishing company called North Atlantic Books, where I co-publish. I'd bring the author in, we'd co-publish the books together. And then I began also writing I wrote ultimately 4 chapters in medical textbooks on homeopathy, 2 of which were published by Oxford University Press, and one which was a 4,000-page manual on pain management. So I just wrote with a physician the chapter on homeopathy and pain management. Mm-hmm. So, I then, as I got married and had a son, and as he was beginning to become an adolescent, I realized I needed to get back into practice. Mm-hmm. So I've been practicing for 20 plus years again, and these days it's great because I'm a Zoom practitioner. I see very few patients in my Berkeley office. I see them from all over the world, and I really feel like Dr. Jetson. Yeah, I think we are in the generation beyond the Jetsons because we have so many things that the Jetsons didn't have. I mean, but we do have these video calls. That's what they did. They did have.
I know. Yes. There's so much to be able to connect these days just with people. I'm here in the Caribbean, you're in California, just to be able to connect with people all over the world and to bring education. I'm in public health. I'm an MPH as well. So exactly. I mean, we fight the good fight always. We're trying to educate, bring more information to people so that they can be more empowered. So thank you so much for what you do and what you've done for so many years. Tell the audience about homeopathy, what it is, what you use it for, all of the things. Of course, I know all the things, but the audience definitely.
Okay. Homeopathy is ultimately the second most popular system of medicine in the world, according to the World Health Organization.
Mhm.
It was started in Germany in the early 1800s by a famous physician and chemist named Samuel Hahnemann, and it spread rapidly throughout the world. And ultimately, in the 19th century, it really took fire in America. And at the turn between the 19th and the 20th century, there were 22 homeopathic medical schools: Boston University, University of Michigan, Ohio State, University of Minnesota, New York Medical College used to be called New York Homeopathic Medical College. Hahnemann Medical College is in Philadelphia, named after the founder of homeopathy. Even the University of Iowa. How about that? And a
Wow.
homeopathic medical school. Anyway,
Midwest. Mhm.
yeah, and ultimately, homeopathy in 1844, the first national medical society in America was the American Institute of Homeopathy.
Yeah.
Now, we were a minority school. The conventional doctors were many more in numbers, but we were the first to organize as a national organization. And 2 years later, a rival medical organization formed. And one of the reasons for their formation, they said, was to slow the growth of the homeopaths.
Yeah.
That group became, and I bet you're going to figure this out, the American Medical Association.
Yes.
Right,
Yes.
right.
Oh yeah.
And then what's so fascinating is in the 1860s, they were so livid against their competitors
Mhm.
is they wrote within their ethics code of the AMA something called the consultation clause, which
Mm.
stipulated that if any regular doctor consulted with any homeopathic doctor on any patient, they would lose their membership in the medical society. And then the medical society at that time in the mid 1800s controlled who had licenses. So if
Mhm.
you consulted with a homeopath, they'd just take away your license.
Yeah. Yes.
Well,
And these
homeopaths have their
systems.
own licensing group so that if they took away
Mhm.
your license, it's no big deal because we got our homeopathic license.
Yeah.
But believe it or not, on the night that Lincoln was shot, this was a part of an assassination plot. It wasn't just John Wilkes Booth. So someone knocked on the door of the Secretary of State's office, who was William Seward, and it was Lincoln's most trusted Secretary of State. And it was known that Seward had a special passion for homeopathy. So the person that knocked on the door said that he had a delivery of homeopathic medicines from his homeopath. So he was admitted into the Seward's bedroom where he was sick, and the guy took out a gun to shoot him, but the gun didn't go off. So he had a backup knife and he stabbed him 7 times.
Oh my
You
goodness.
know,
Wow.
the assassin ended up getting away, but the first doctor on the scene, it just happened to be the Surgeon General of the United States. So he helped stop the bleeding and helped save the life. And then they contacted the homeopathic doctor, who then came to the scene, and they ultimately saved the Secretary of State. However,
Mm.
this doctor that helped save the life of our Secretary of State was reprimanded by the AMA for saving the life of a homeopathic patient.
Wow.
So, you know, this is the level that
Yeah.
the orthodoxy has historically gone to attack competitors.
Yeah.
And then they ended up taking it away in the early 1900s, but not because their hearts had opened. Not they came up with a different, more diabolical strategy. And that this became known as the Flexner Report.
Yeah.
And the Flexner Report was a report issued by the Carnegie Foundation about the state of medical education.
Mhm.
And this Flexner actually was known to have a very secret relationship with the head leading people of the AMA. And when he went around to different medical schools to evaluate them, he went along with this leading member of the AMA.
Mhm.
And mind you, the AMA hid this information for decades.
Mhm. Yeah.
And as it turns out, this report ended up recommending closing of the homeopathic medical schools, closing of all the women's colleges, closing of all the Black colleges.
Yeah.
Well, obviously, these guys are not the good guys.
Right. Exactly.
And
Exactly.
what's really interesting, you know, the word gaslight, we've all heard
Mhm.
about it. Well, the original story stems from the president of the AMA who was doping his wife and then doing different things so that she would think she's crazy because he had a woman or two on the side and wanted to get rid of the wife. But before she got too crazy, she realized what she was doing. And this became one of the leading, really amazing stories about this president of the AMA. And a playwright ended up making it into a play. And then a movie guy ended up making it into a movie. But they took out all the information about the AMA, all the information about him even being a doctor. But that just tells you some of the juicy bits of history, because history really is fascinating.
It is. It is. Yeah. And the medical monopoly, especially.
Oh, medical monopoly. And also what I call medical chauvinism. It's the belief that there's only one way to do healing, which historically and internationally is wrong. I mean, even the World Health Organization recognizes that between 70 to 80% of the world's population relies upon what they call traditional medicine, which is not conventional medicine. Traditional medicine is botanical medicine, is homeopathic medicine, is, all these other type of natural therapies that people have been using. Because if you think about it, for those of us that believe in evolution, we have survived as a species because that doctor inside each and every one of us is brilliant. That not that our body can heal everything, it can't. And that's why we use different natural therapies to help the body. But the important thing to understand about evolution is that whatever the body's doing has a certain wisdom. And it has a history of success with. And so we have been exposed to infectious diseases. And the way our body-mind treats that is with inflammation and fever. And during a fevered state, our body then naturally secretes antibacterial and antiviral chemicals. And then if you take a drug to lower your fever, your body will say, oh, the infection's over. So we don't have to now fight an infection. And that's why you should literally never take fever-reducing agents. And even some natural docs encourage fever-reducing agents. Just, I respectfully disagree with them.
Yes, me too.
And now there are exceptions, of course. If your body's temperature is over 103.5 for more than a couple hours, yes, you do need to do something, going into a cold bath or something. But the other thing to do is to use homeopathic medicines or natural medicines specifically for these higher fevers. One of our great remedies is belladonna. But whenever I mention any medicine, just to let you know, we don't have a this for that thinking in homeopathy. It's not that a medicine is good for a disease. Every medicine is good for what I call a syndrome, of which disease is a part. So you may have a migraine headache and I might have a migraine headache, but your migraine headache will be very different than mine. I mean, you'll be sensitive to light. I'll be sensitive to noise. I'll get it in the morning. You'll get it after a long day of work. You'll get it with nausea. I'll get it with dizziness. I mean, how or why anyone would ever think that simply because you have a disease and I have a disease that it needs the same drug is the most unscientific and very creative logic. And so once again, once you realize that symptoms are defenses, then instead of making drugs that go against the wisdom of the body, you look for medicines that mimic the wisdom. So homeopathy actually has two really elaborate sciences within it. One is a science of toxicology. Our books that are called Materia Medica, which is a Latin term for materials of medicine. That's all it is. So these books list a medicine and they describe the symptoms that substance is known to cause in an overdose. So that when a person is sick, you look for a medicine that matches that pattern, that has that headache that's worse by motion, that has the headache that's in the front part of the head, that has a dry mouth and a big thirst, cold water, and there's a certain pattern. And now we even have expert system software, so you type in what symptoms a person has, and it tells you what medicines fit each of the symptoms and which is the ones that fit the pattern most closely.
Yes.
And then what ends up happening, for those of us that have any degree of respect for that body that we presently inhabit and that brain that is so magnificent, we have a radar ability to use extremely small doses of medicines. And then what we do in homeopathy, we make these medicines through a specific process I won't get into right now, but it's a process of diluting and shaking and making the medicine smaller and smaller. And they will not have any effect at all, except if that substance is known to cause an overdose of similar symptoms that you have. And that substance, because it's so small, is able to penetrate cellular membranes and go into the blood through the blood-brain barrier. Wow. And then inside the cell and inside the brain, it says, we've been attacked by arsenic. And because you're having symptoms like as though arsenic was having on your body, it becomes what I like to call a medical aikido. Aikido is that martial art that's totally different than boxing.
Yeah.
And then hitting a person and getting hit back. The Aikido master tries to take the force of the punch to draw the person to the floor. And ultimately, because our symptoms are defenses, it's taking that force that the body's using to fight the infection to aid the survival. Because that fever is a defense. The diarrhea, your body's trying to get rid of bacteria. Please don't shove it back up. Please don't a aid to constipate you if you have diarrhea. And another example of a homeopathic medicine is coffee.
Yeah.
Now, in homeopathy, we don't use it to stimulate a person. We use it as one of our major remedies to help people go to sleep. Now, but for everybody that has insomnia, because it's only if a person gets into bed and their mind is going a mile a minute and their body is hyperactive, these are the symptoms that coffee is known to cause. Now, in every lecture I've ever given, and I've given 1,000+ lectures, I often ask people, how many people themselves or know someone that might be a regular coffee drinker, but needs to drink a little coffee just before bedtime? And inevitably, someone would raise their hand. But also, we all know, too, that hyperactive kids are given amphetamine-like drugs to cool them down.
Yes.
So if you give an amphetamine-like drug to a normal kid that's not hyperactive, they will get hyperactive. But if they're already hyperactive, it does relax them. But we don't use Ritalin. We don't use the amphetamines. We use substances that also cause hyperactivity, like coffee. Or we even use homeopathic doses of silver. Now, silver as a metal is the most highly conductive metal. So these kids are literally conducting energy.
Yes.
And what's so interesting about one of the types of silver, there's a type of silver called silver nitrate. And in homeopathy, it is known for helping kids who are hyperactive after sugar binging. So, there's a beautiful system to homeopathy. And what's so great about being a clinician is I see my patients on Zoom, because as a homeopath, I don't have to be present. I don't have to put needles in someone. I don't have to crack their back or take their pulse. I need to interview them to find out what symptoms they're having.
Yes.
And then I'll send them the medicine. They get it in a couple of days. And the whole idea is that the symptoms, once again, are defenses.
Yes.
So instead of suppressing the symptom and the defense, and that is why, by the way, a conventional medicine, when it works, That's the bad news usually.
Yeah. It is.
Because the headache goes away, but then you develop high blood pressure. The,
Correct.
the skin rash goes away, and then you develop asthma.
Yeah, and this
Uh,
is why I'm always trying to teach patients the different way of thinking because of course, because the medical monopoly in conventional medicine has been such the forefront, people are very highly reactive. They're into symptom management. They don't want to sit with their symptoms or be present with their body when their body's experiencing things. And instead, they want to reach for something to satisfy or soothe, but of course we know that just suppresses and brings it under the surface. So it can be frustrating as a clinician when patients have kind of continuously done that, right? And they're like, okay, I'm tired of that model. I don't want to be in the diagnose and manage model anymore. I want to find root causes. So then they come to a root cause clinician such as myself or yourself, right? And then they want to apply that same diagnose and manage model with more of causative. And so really it's about getting the public re-educated. And we've talked a little bit about RFK. Of course, it's good or bad, right? We're trying to find good lining everywhere, right? I love your optimism. But I think one of the things that's important with RFK that he's bringing out, which I've seen in family practice for so long, is the microbiome, is the gut microbiome, is children. So when you're pregnant, right, there's a lack of perinatal care. So a lot of times women are like, oops, I'm pregnant. They're not preparing a year, 2 years out prior to get their bodies well enough to get pregnant. It's mostly an oopsie thing. So then that first 2,000 days of life from conception to 2 years old is when their immune system is developing. But unfortunately, that's when they're being given toxic formula. That's when they're being given shot after shot after shot, which is going to suppress their immune system. Then they're given antibiotic after antibiotic to be able to treat ear infection and all of these things. And it's just this continual cycle. So it's not a wonder that chronic disease rates are rising, that immune system disorders, autoimmune conditions are rising. There's so many different conditions that are happening. So can you speak
and
to
mental illness. Mental.
ah yes. Yeah, please go ahead and speak to
You see, what ends
all
up
the things.
happening is when you suppress physical ailments, they'll also influence how we feel emotionally, mentally. And the first thing that I say to many patients is, please know that you have physical symptoms, you have mental symptoms. It's not that the mind creates the body. It's a two-way street. It goes back and forth. And you can be physically ill and that create irritability because often it's related to the liver, and liver is known to be full of bile. And there's a good reason why our language says a bilious person is not just full of bile, but is angry. And then when people have fears, often it is related to the kidney meridian because the kidneys, right above the kidneys, are the adrenal glands. and depression related to the lung meridian because you're literally, had your breath taken away from you. And so it's this two-way street. And mental illness is often the result of a person taking a conventional drug to suppress an ailment. Mm-hmm. Now, the good news about homeopathy, it is also drugs. It is also medicines. And it can often rapidly get rid of symptoms, but it does so completely differently. Instead of suppressing the symptoms, these medicines strengthen the body's immune and defense system so that what's interesting, when people have a chronic disease, about between 20 and 30% of my patients with chronic disease, after I give them the remedy, during the first 1, 2, or 3 days, have an increase in certain of these symptoms. And then it goes away. I mean, it's like, especially I see women, and they might have different genital urinary ailments and even some menstrual problems. After giving a homeopathic remedy, they'll have an early menstruation. It will often be very clotted, and it's because the body is literally cleaning itself out.
Exactly.
Or a person will get a skin rash because we find in homeopathy that as a part of the healing process, people get better by externalizing the disease. So a person will vomit. A person will have, like I said, an early menstruation. They'll have a skin rash. These are good signs.
Yes.
And so there will be sometimes a storm before the dawn. But what we find is even people that have high blood pressure, what will happen is their symptoms will externalize, but the blood pressure will go down.
Mhm.
And even a depressed person will not get more depressed and suicidal. Quite the opposite. They'll say, God, I'm now really pissed off. I'm not as depressed. And it's because their body is now really struggling and expressing something rather than holding it in.
Mhm.
Because all too often we do suppress emotions, but just as much with drugs, we suppress physical symptoms and physical defenses.
Mhm.
And so that's the one
Yeah.
great thing. And I know some your whole emphasis here is decolonial, colonialize.
Well, decolonizing. Yes. Yes,
And
absolutely. Especially too, because people when their bodies are expressing symptoms, I'm finding because of iatrogenics and medical trauma, they're so afraid of their bodies. They have literally disconnected from their bodies to the point that when their bodies are expressing a healing situation, they're interpreting as something's wrong and bad, and they need to go run to the ER and suppress the symptom. And so it's a real disconnect with how the body actually heals versus how it's been marketed as it heals.
right, right. Now I've written 10 books, and a number of them are what we call homeopathic guidebooks that teach people how to use a homeopathic medicine. And then in the 10 years ago, I created an e-course called Learning to Use a Homeopathic Medicine Kit, because I want people out there to not need to go to doctors for many acute ailments. And that's many common minor ailments. However, when you have a serious ailment, a recurring ailment, or something that is of a more serious nature that people can die from, here's where you need to go to professionals.
Yes.
You need to get experts. And because it's not as though homeopathic medicines work, you have to find out the right one. I mean, there are
Yeah.
literally hundreds and
So many.
thousands of remedies. And
Yes.
and you can't go online and say, well, what does homeopathy have for migraine headaches? I mean,
Yeah.
you'll get an answer and you'll get
But
a list of certain numbers of
yeah,
things, but it still is
yeah,
challenging. And then you have to figure out the dose.
exactly. Hmm.
And here's where, once again, going to a homeopath is helpful.
Yes.
And many of us are doctors, medical doctors, naturopathic doctors. Some of us are homeopathic doctors. And so some of us are able to take insurance, some of us are not able to.
Yes.
So that is varied.
Yeah. Yeah.
But if
Yeah.
for
And
those of us that,
I think just getting out, even out of the insurance-based model in general, just because with insurance comes strings attached, right? So, and your insurance is not going to pay for your homeopathic provider, right? Because it's a direct competitor. Again, this is a medical monopoly, right? And so, again, we can't keep going to our oppressor looking for help. Our oppressor is not really in the interest of helping us. And so this is where we really have to disconnect. But we also talk about cost, of course, right? Because people have different financial obligations. But look at the cost of, I would say there's no flash sale on diabetes. There's no, buy one, get one, free cancer. And so investment in your health is very important. Myself, even when I was a single mom, even when, I put myself through health school, all kinds of stuff, right? I always invested in my health because I knew that if I didn't have my health, the rest of it wouldn't be, and so there is this consciousness of, oh well, if my insurance doesn't pick it up, then I'm not going to invest in it. But if you think about how when I get patients, and I'm sure you get the same thing, I get patients that have been to every doctor underneath the sun, have paid every copay underneath the sun, have run around, have gotten sicker and sicker and sicker. And so, if those patients would immediately go to a homeopathic doctor or a naturopathic doctor or somebody who is more root cause driven, they could save themselves so much time, so much money, so much stress. And also, too, I'll say this part and then I would love to hear your conversation on it. One of the things that drives me nuts about homeopathy, because so we know there's classical and there's complex case taking, right? And so one of the things that drives me nuts is and not to throw companies out there, but when they sell homeopaths in these little bottles that say the acute care, oh, this is good for this and this is good for that, it really gives this false sense of security. Like, oh, if I'm just going to grab this, and then if it doesn't work, right, then oh, homeopathy doesn't work. This is junk. Not
Right.
realizing there's very much an art to it. It's not like a supplement or an herb that you can go look up, what it does and then take it and it works better. So
Yes,
can you
sir.
speak to that a little bit?
Yeah. There is, just that, as you well summarized, there's different schools of thought within homeopathy. And you and I are oriented towards what we call the classical model of homeopathy, where we look to find one remedy because because your headache and your constipation and your irritability and your depression are connected. And,
Yes.
however, the bottom line is many people want to try doing something on their own before they want to spend a couple $100 to go to a homeopath. They want to try something, but just don't be fooled to think that that is really testing homeopathy. Now, that said, people go to doctors for their entire life, and their ailments are just managed. They have it, and so the question you need to ask yourself, 1 or 2 days of the week, I'm not able to operate it at adequate functioning. How worth it is it for the rest of my life to have those 2 days back a
Yeah.
week? And and also, I mean, just menstrual dramas. I mean, don't feel like just because you had them as a teenager and you had them in your young adult life that you have to live with them. I mean,
Right.
it's amazing how well homeopathic medicines, relieve women of menstrual difficulties, and then will make menopause a lot easier. And let alone all the different sleep deprivations that we've had. And in fact, I commonly measure how much improvement I've been able to have on a person's life based on sleep, because you cannot will yourself to sleep better. And
Mhm.
so there's no placebo effect. Now, there's all types of placebo effects with pain management, you know, but I want to let you know that a lot of skeptics say that homeopathy is completely a placebo. But I want to make certain you know that when I prescribe a homeopathic medicine, I usually prescribe 2 doses per month.
Mhm.
And that's not a good way to elicit a placebo effect. If I really wanted to elicit a placebo effect, I'd say take it 4 times a day, maybe
Of
even
course.
6 times a day, just to remind them that you're taking a medicine. But,
Exactly.
in homeopathy, the medicines are catalysts to our body's own immune defense system.
Yes.
And I was talking with a homeopath just yesterday, and we were bemoaning the fact that we commonly see our patients, and then a long lasting condition goes away, and they say, well, my body finally healed itself. And they
Mhm.
don't even think the homeopathic remedy had anything to do with it. But
Mhm.
what ends up going on is the medicine does catalyze the body to heal itself. So internally, it feels like this wasn't the medicine. My body healed itself. But of
Yes.
course, it was catalyzed by the medicine.
Of
And
course.
and and that's what's so beautiful. Now, one thing that's interesting historically is the first scientist to win the Nobel Prize in medicine did so for discovering the diphtheria vaccine.
Mm.
And after he won the Nobel Prize, he thanked Samuel Hahnemann, the founder of homeopathy, for giving him the idea of
Oh.
creating a vaccine. Because believe it or not, in the same year that Edward Jenner did his first experiments with cowpox and smallpox was the very same year that Samuel Hahnemann first wrote about this homeopathic principle. And
Mhm.
some people learned about this principle about homeopathy, and others learned about vaccinations.
Yeah.
And the doctor who won the Nobel Prize also realized that if he would have said this before he got the Nobel Prize, he probably would not have gotten the Nobel Prize,
Right.
because there was that degree of antagonism to
Mhm.
homeopathy. And since then, the stories about vaccines have been all fabricated.
Oh,
There's
yes.
so much misinformation about vaccines, and
Yes.
and the fact that conventional pharmaceutical houses claim that they are the most researched, and yet in the 21st century, they're not even studied against a placebo. Because if you study them against a placebo, you'd find that there's a large difference in neurological problems with people that have gotten the more vaccines. And one thing that people don't know that I think Bobby Kennedy is going to finally get out is a senior scientist at the CDC has admitted that his group falsified data, and there was a increase in autism in Black children.
Yes. Black boys specifically.
Yeah, Black boys. And this is a part of our racism again.
Exactly.
It's not even racism, it's economic opportunity from the big pharma. And even during Barack Obama's administration, this senior scientist by the name of William Thompson, he achieved whistleblower status, but he's been not allowed to talk. From Obama to the first Trump administration through Biden. And no one's wanting to talk about it right now. But when the new head of the CDC finally comes in, this is going to explode on the scene, and it's real.
Yeah, and so people, obviously the Black community, many of us love Obama, right? But I've always said that Obama really led us into a burning building, especially when it comes to our healthcare. I think that people so badly wanted to have something for health, right? And let me be clear, an expansion of health insurance is not healthcare. Okay. And so that's really what's been marketed as an expansion of health insurance. And also on the back end, what people may not realize is all the deals that were done with pharma in order to have the ACA put out there.
That's right. They were buying, government was buying their drugs at retail prices, even though we were spending billions of dollars. And they had to make that deal. The bottom line is, here's a statistic that will blow everyone's mind. And if it didn't come from the source that I'm about to tell you, I wouldn't believe it either. But there was a woman editor of the New England Journal of Medicine who ended up writing a book called The Truth About Drug Companies. She ended up quitting that editorship, and now she's a professor at Harvard. She wrote a book, and she said that in the year 2001, if you took the Fortune 500 companies and you took the 10 big pharma companies out of the Fortune 500, those 10 big pharma companies made more profit than the remaining 490 companies combined. So first of all, if there's any field that there's that much profit, then that itself is not just a red light, but a maroon light of warning. There's cheating going on. There's cheating going on. And there's a reason, the simple reason why you see so much drug ads on the news is they need to own the narrative on the news.
Absolutely.
And they don't make money on those ads as much as get control.
Exactly. It is indoctrination.
And it's the same thing with the gun companies. 80% of Americans want gun control, but that doesn't happen because the gun lobby owns politicians. And the same thing will happen around this. And until we stop allowing drug companies to advertise, that's really one of the critical things that we need.
Yeah, and I think that he is making strides in that. What I also saw in the hearing, which was interesting, and I always tell people, with politics, it's not always what is said, it's what's not said. And so that kind of, fury, that moment where they're like, oh, well, Black people, of course, he left the people out. So that emboldens. But, the Black people really were more susceptible when it comes to our immune systems are different. So it more susceptible when it comes to these inoculations. And
you were saying that Black people have stronger immune systems. So he's a racist for saying that Black people have stronger immune systems?
Yes.
Oh, wow.
it's emboldened, of course, but also look at the person on the other side, right? And look at who they're paid for, and look at who their lobbyists are. When I did, when I did lobbying in Virginia, the Democrats wouldn't talk to us. They would not talk to us at all. It was only the Republican Party, and I could only, stomach it for as long as I could before I bailed and I left the United States, simply because you're an uphill battle with the pharmaceuticals. So, and I don't really care what side of the aisle that you're on, because for me, it's about medical freedom and it's about health freedom. I also recall there was an Ohioan pediatrician, and he did kind of an impromptu with his own office, and he tested patients that inoculated and patients that didn't, and he found that naturally the patients that didn't inoculate, their immune systems were far
I
stronger.
think it's
They
David
didn't need.
Career.
Yes, yeah, okay, yeah, I
In
remember
fact,
him.
he's now being put in, he's going to be doing one of the big studies. He's been
Amazing.
asked to do one of the big studies that really will use a placebo and really test how effective the drugs are and how safe the drugs are.
Yes.
Because for a long time, they haven't really done safety studies.
No, they just did across the board. They said, "Oh, these are safe and effective." And then they also conflate history, where they go, "Oh, wouldn't be a polio wouldn't be eradicated without the inoculation," not recognizing that no, it wasn't that. It was the fact that we stopped bathing in our own feces and we got indoor plumbing. And so again, association between
By the
what's
way, the other thing,
good.
the polio thing is really messy because in 1950, DDT was getting more popular. And in rural areas, they were spreading DDT all over. And the neurological paralysis that DDT is known to cause is similar to polio. And the also thing that ended up happening was the definition of polio changed completely. The diagnosis of polio changed completely, once the vaccines were developed. And in fact, as it turns out today, there is a type of paralysis that affects young kids. And they're getting 1,500 of these unusual, what's called myelitis, which is ultimately very similar to the original symptoms of polio, 1,500 a month in America. And yes, they're no longer iron lungs, but they're now called ventilators. Oh, yeah.
Yeah, there's just so much conflation and misinformation. And this is also why I decided to do Decolonize Your Healthcare, is to help especially the Black community begin to wake up, because we've been tested on, our Black bodies have been tested on, even in the beginning with the medical apartheid, Washington, and we were practiced on with inoculations, right? And we know because of intergenerational trauma, because of methylation issues, we have more instability around our nervous system. And so we have to be incredibly diligent. When I did the research when my daughter was little, when I was like, because of course the big pressure, they go, "Oh, you got to inoculate." I did my research. I wasn't a doctor then, but I did my research and said, you know what? This is like Russian roulette. I'm not going to put my daughter through this because I don't really know, because of the instability around the nervous system. And maybe it causes it, maybe it doesn't, but it's definitely not something that's going to help support an already fragile nervous system. So we decided to not inoculate. And at that time, it wasn't a big deal. You still had informed consent. Well, that we find is slipping away very, very, as time goes.
We're not being informed at all. In fact, we're being the misinformation. And the thing that's so interesting is that the orthodoxy projects the attacks on us as to what they're doing.
Yeah.
The misinformation we're finding around the pandemic was we needed to listen to the people that were silenced.
Yeah.
And we needed to really question who really it represents science.
Yes.
And we need to wind down here, but I do want to let people know that if you want to contact me and my work, my website's an easy one to remember. It's homeopathic.com.
Yes, exactly.
And we're a great site. I have 100 articles. Also, I've got a really popular blog on Substack. So if you just Google my name and the word Substack, or Google my name and the word homeopathy, you'll get to homeopathic.com. We sell books and tapes and
Yeah.
medicines and software
Yes.
and these e-courses.
Yes.
And like yourself, I see patients.
Yes,
Yeah.
and I love the fact that you're so accessible, which is why I wanted to ask you to come on the show. Not only are you experienced, you've done this for a long time, but also really accessible. So anybody from any background can pick your work up and really follow along and get it, because again, especially for the acute conditions, cough, cold, flu, ear infections, all of those things, we don't need to be running to an antibiotic. There are homeopathic remedies that can help resolve those, that you have tons of literature on that. And so really educating people to get transition them off of that, out of that reactive model into a more proactive one.
Just one kid with one ear infection. I mean, if you're able to help that child, then not only does that ear infection not last a week, last a day or two, but then it doesn't come back.
Yeah.
And the improvement in that child's health and in your whole family's time and attention, and it makes it so worth whatever it takes
Yes.
to get real healing.
Exactly. Well, thank you so much, Dana, for the work that you do. I really appreciate you. Thank you so much for agreeing to have this interview with me, because, again, we need more voices out there. We need more people that are educated about these things. And so just thank you. Thank you so much, from one MPH to another. Thank you. Bye.
Indeed.
Yes, and
Be
I'll
well.
put all the links and stuff, all your links below. And so everybody will have access. So it'd be great.
But, I don't think you'll need to edit this at all. I mean, I
No,
think
no,
we
no.
just nailed it.
Mm-mm. Yeah,
Well,
exactly. Yeah, I'm really